Hi, my name is Jennifer. I'm going to be doing your assessment today. I'm going to start out by looking at your hands. Your skin is warm, dry, and intact. I'm going to look at skin turgor. It's elastic, meaning good hydration. Look at your nails. They're clear, no clubbing. Test for capillary refill is less than 3 seconds. I'm going to look at your head. You have normal distribution of your hair. I'm going to palpate your scalp. You have no lumps or lesions. Noted. I'm going to start by looking at your eyes. I'm going to have you look straight ahead. I'm going to have you tell me when you see my finger, okay?
No.
Good.
No. No. No.
Good. Cranial nerve 2, optic is intact. So I'm going to have you cover one eye and uncover, and then cover the other eye and uncover, so I don't know any strabismus. This time I'm going to have you follow my finger. Good. Cranial nerve 3, 4, and 6 are intact. That's trochlear, abducens, and oculomotor. I'm going to go from there, and we're just going to look, and your eyebrows are symmetrical, your eyelashes are evenly distributed. I see no lesions or redness around your eyes on the skin. I'm going to have you look up. I'm going to pull down. Your sclera is white, your conjunctiva is clear. I'm going to have you look straight ahead again and use this light here and look at your pupils. They're round, equal at 3 millimeters, and reactive to light. Have you look ahead again, and when you see my finger, just kind of look in. Good, your accommodation is intact. From there, we're going to take a peek at your eyes a little closer. So go ahead and stare straight ahead. And your red reflex is present. Your ocular fundus is sharp at 0. Your optic disc is clear. Your retinal background is clear. Your macula is even. Next, I'm going to look at your ears. They are equal bilaterally. I'm going to go ahead and pull on your pinna here and push on your tragus. Is there any pain?
No.
Good. I'm going to look in the auditory meatus. It's clear. There's no discharge or redness. I'm going to go ahead and look in your ears. And the external canal is clear. The tympanic membrane is gray. Your cone of light is visible at 7. Your malleus is visible as well. I'm going to do a little hearing test. Can you hear this?
Mm-hmm.
Good. And can you hear this?
Mm-hmm.
The cranial nerve 8 acoustic is intact. And there we're going to look at your nose, which is midline. The skin is intact and normal. I'm going to have you sniff in each side here and sniff this side. Good, your nares are patent. And there we're going to go ahead and look into your nares. Good. Your nasal mucosa is red. Your turbinates are red and no polyps. And there we're going to look into your mouth. Go ahead and open for me. Good. Your gums are red, your dentition is normal, your hard palate is white with rugae, your soft palate is pink and smooth, your gums are red, your tongue is red with papilla. I'm going to do a little test here and have you stick your tongue out again and say ah.
Ah.
Your uvula is midline and rises, meaning cranial nerve 9, hypoglossal, glossopharyngeal is intact. I would test cranial nerve 10, vagus with the gag reflex, but we won't do that to you. I'm going to have you do one last test where you stick out your tongue. Good, it protrudes midline and evenly, so cranial nerve 12, hypoglossal is intact. So from there, we'll look at your neck. Your skin is appropriate color, no lesions are noted. I'm going to look here in your trachea, which is midline, not enlarged. I'm going to palpate your carotids one at a time here. Look at this side. And they're even and equal bilaterally. We're going to go ahead and listen to those. Use my bell. Go ahead and take a deep breath and hold. And listen. Good. And let go. And then one more time. I hear no bruise noted. From there, I'm going to try to have you swing around, and we're going to look at your backside here. The first thing I'm going to do is palpate your thyroid. So to do that, I'm going to have you swallow and swallow one more time. Good, and that is equal, no enlargements. I'm going to just inspect your back here, and everything is even. Your skin color is normal, everything's intact. Your spinous process is midline. From there, I'm going to palpate. Any pain?
No.
Good. I'm going to have you say 99 every time you feel my hand.
99, 99, 99, 99, 99, 99.
Good. That's testing for tactile fremitus, which is normal. I'm going to go ahead and percuss here, side to side. Good. I hear resonance throughout, which is normal. I'm now going to go ahead and listen to your lungs. So just take a deep breath every time you feel my stethoscope. Good. I'm going to hit 8 different points. We're almost done. Good. Everything is normal, no decreased or adventitious sounds. I'm going to do that one more time, and each time you hear me, or feel me, excuse me, if you'll say E, I'm just going to take a listen, okay?
Mm-hmm. E, 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 E.
Good. I hear E normally. We're testing for egophony, which means no consolidation. I'm going to have you swing back around. I'm going to look at your front side again. We're just going to inspect your chest. We're going to note that your respirations are easy and unlabored. I'm going to note that, again, skin color is appropriate. No lesions are noted. I'm going to go ahead and palpate up here. Any pain?
No.
Good. And I don't note any pulsations. We're going to go ahead and percuss again on this side, side to side. Good. Again, we hear resonance with some expected cardiac dullness. From there, I'm going to listen again to your lungs. So just take a deep breath. Good. I don't hear any decreased sounds or adventitious sounds. I'm going to do one last listen. We're going to listen to your aortic and your pulmonic. And your rhythm is regular. I hear S1, S2, and no murmurs. So from there, I'm going to have you lay down. Thank you. So first I'm going to inspect. I don't see any pulsations or heaves noted. I'm going to palpate over here at your apical pulse, which feel rhythm is regular, and we're going to listen to that. Good. You have an apical pulse of 60. From there, I'm going to listen to the rest of your heart tones. I'm going to first listen with my diaphragm at the aortic, pulmonic. We have herbs, tricuspid, and mitral. And then I'm going to turn around and listen with my bell. So we're going to do, again, the aortic, which is the second intercostal space, right sternal border. The pulmonic is the second intercostal space, left sternal border. You have the third intercostal space, left sternal border, fourth intercostal space, left sternal border, and the fifth intercostal space, mid-clavicular line for that mitral. Everything sounds normal with 2+ and no murmurs. I'm going to go from there and look at your abdomen. So I'm going to go ahead and inspect your abdomen. You have a flat contour. Your skin is clean, dry, and intact. No lesions are noted. From there, I'm going to go ahead and listen to your bowel sounds. I'm going to start in the right lower quadrant. Good. I hear normal bowel sounds that are active. I'm going to go ahead and percuss in each quadrant here as well. I hear timpani throughout. So I'm going to do some light palpation starting in your right lower quadrant. Any pain or tenderness?
No.
Okay, we're going to go from there and do some deep palpation. Trying to feel your liver span here at 6 centimeters. Go down. Any pain?
No.
I don't palpate the spleen or kidneys. They're unpalpable, but I can palpate that the aorta is 3 centimeters wide. So from there, I'm going to go to your lower extremities. I'm going to note that they have equal hair distribution. The skin is clean, dry, intact. No lesions. Skin is warm. I'm going to go ahead and feel for your pulses, your popliteal, your posterior tibial, and your dorsalis pedis. They all feel 2+ and equal. From there, I'm going to have you do some range of motion. So we'll lift this leg up and lower. Good. Can you bend at the knee? Good. We're going to externally rotate, internally rotate. Good. And lower that. Perfect. Can you raise your ankle up, foot up? There you go. And down. And twirl it around. Good. And stretch out your toes. So we're testing for range of motion of your hips, knees, ankle, and toes, and all of that is intact. I'm going to go ahead and have you sit back up again. We're going to look at your upper extremities. Again, they look even bilaterally. Your skin is clean, dry, intact, no lesions. Skin is warm. We're going to look at your radial pulses here. And then your brachials. And those are 2+ and equal bilaterally. We're going to do some range of motion again. So go ahead and stand up and down. Good. Can you put your hand around and back? Perfect. Go ahead and bend up and down. Good. And then flex your wrists and extend, and your fingers. Good. So we're testing for your shoulders, your elbows, and your wrists. Everything is normal range of motion. From there, we're going to go to your neck. Go ahead and flex forward and back and side to side. Good. And then I'm going to have you shrug your shoulders against me. Good. And push against me this way and push against me this way. So your range of motion is intact, as well as your cranial nerve 11 spinal accessory. Here, I'm going to go ahead and palpate your lymph nodes. So you have pre-auricular, post-auricular, occipital, submental, submandibular, jugulo-digastric. I'm going to palpate your superficial cervical, your posterior cervical, and I'll have you turn your head, and this is your deep cervical. I'm going to palpate your infraclavicular, your supraclavicular, and while you shake my hand here, your epitrochlear. All of those lymph nodes are not palpable, which is good. So we're going to go from there. I'm going to do a few tests for sensation here. So this should be soft on your ophthalmic, maxillary, and mandibular. Does that feel soft? Mm-hmm. Okay, then we're going to do sharp versus soft on your extremities, okay? Tell me what you feel.
A poke.
Sharp?
Yes.
Okay. And what about on this side?
The same.
Okay. And what about here?
Soft. Same.
Okay. We're going to do your lower extremities. Tell me what you feel.
A poke. Hard.
Sharp?
Yes.
Good. And this side?
Same.
This side is?
Oh, soft. Excuse me.
Versus that.
Oh,
this
yeah.
is sharp. Okay. Good. We're going to go ahead and do your reflexes. So I'm going to go here and do your triceps. And then we're going to go here and do your biceps. Try it one more time. There we go. And your brachioradialis. Good, sorry. I'm gonna have you try to dangle your feet a little bit. We'll do your patellar. Good. And your Achilles. And then if you can bring your leg up here, we're gonna look at your plantar. Good. All of your deep tendon reflexes are 2+ and intact. The next thing I'm going to do is have you hold out your hand and close your eyes. We're going to look at stereogenesis. Let me know what I'm putting in your hand, okay? Go ahead and cup your hand.
Paperclip.
Good. And bring out your other hand. We'll do this side. And tell me what you feel.
A quarter.
Okay. Man, you're good. Okay, and one more time.
A paperclip.
Okay, so stereogenesis is intact. From there, I'm going to have you stand up. I'm going to have you walk just a couple steps heel to toe. Good. Your gait is steady and even. You can stop there, put your feet together and your hands down, and just close your eyes for a second. This is the Romberg test. We're testing position and you're intact. From there, I'm going to look at your range of motion. So go ahead and bend backwards, and then each hand to each ankle there, side to side. And then if you'll turn that way and bend forward, your hands to your toes there. I'm going to also be looking at your spine, which is no curvature, and midline. If you'll go ahead and sit back down, we have one last test here. If you'll do your hands on your hips and do them kind of quick, good. And then take your right leg down the shin of your left and do the opposite, left on the, good. So your cerebellar function is intact. I think that is all for your assessment today, so thank you.